Hey guys, how's it going? This is FixerMed, and welcome back to my ECG Skills Builder Workshop video series, where I'll be showcasing all the fundamental knowledge and skills you'll need to read and interpret an ECG. This will be part 2 of my multi-part video series in this Skills Builder Workshop series. So without further ado, let's go ahead and get started on today's content. So today I'm mainly going to be giving a brief overview of what electrocardiography is and what an electrocardiogram is. So electrocardiography involves the measurement of the heart's electrical activity which emanates through the skin. This activity is recorded via skin leads and corresponds to the heart's depolarization and repolarization phases. The resultant graph, known as an electrocardiogram or ECG as well, serves various diagnostic purposes. These include identifying rhythm disturbances, conduction abnormalities, and electrolyte imbalances, providing information about the size of heart chambers and their relative position in the chest, aiding in the diagnosis and monitoring the progression of conditions such as myocardial infarction, MI, ischemia, and pericarditis, monitoring patients recovering from MI, assessing drug effects, and evaluating the function of artificial pacemakers. Let's go ahead and move on and talk about certain types of ECGs. So we have resting ECGs, which are used to diagnose primary conduction disorders, arrhythmias, hypertrophy, pericarditis, electrolyte imbalances, extent of myocardial infarction, recovery from myocardial infarction, and to evaluate pacemaker performance and the effects of medications like cardiac glycosides and antiarrhythmics. Exercise ECGs, which assess heart functional capacity, identify the origin of pain, screen for asymptomatic coronary artery disease, also known as CAD, detect arrhythmias during exercise, and evaluate the effects of antiarrhythmics and changes in cardiovascular function post-exercise. Next, we have ambulatory ECGs, which monitor cardiac arrhythmias, assess the effects of medications, evaluate chest pain and cardiac status post-pacemaker implantation, assess shortness of breath, syncope, dizziness, palpitations, and evaluate ST changes indicative of ischemia. I have a few examples of each of these ECGs to the right. So resting ECGs is the first one, exercise ECG picture on the second one, and then ambulatory ECG for the third picture. So hope these serve as an introductory visual aid. We'll be going into way more detail about each of these in the upcoming videos, so stay tuned. Mainly serves as a broad overview of the topic for now. But let's go ahead and test our knowledge of everything we've learned today. What is the primary purpose of ambulatory ECG monitoring? All right, I think I gave you guys enough time here. Pretty first order question. Let's go ahead and take a look at what the answer is. If you need more time, please feel free to pause the video. Moving on now. Ambulatory ECG monitoring, as described in the provided material, is primarily utilized to monitor cardiac arrhythmias. It involves continuous recording of the heart's electrical activity over an extended period, typically 24 to 48 hours or longer, allowing healthcare providers to detect and analyze any abnormal heart rhythms or arrhythmias that may occur during daily activities. Therefore, option E is the correct answer as it aligns with the intended purpose of ambulatory ECG monitoring. So, option E, monitoring cardiac arrhythmias, is the proper answer here and correct answer. Let's go ahead and take a look at why the other answer choices are incorrect. Assessing heart functional capacity is typically associated with exercise ECGs, not ambulatory ECG monitoring. Monitoring patients recovering from myocardial infarction is more commonly done through resting ECGs rather than ambulatory monitoring. Evaluating the effects of antiarrhythmic medications can be part of the purpose of resting ECGs, but it is not the primary purpose of ambulatory ECG monitoring. Screening for asymptomatic coronary artery disease is another purpose of exercise ECGs, not ambulatory monitoring. Let's go ahead and take a look at the next question. What type of ECG is most suitable for evaluating the effects of cardiac glycosides? Pretty first order question here, so I'm going to go ahead and move on now. If you need more time to think your answer through, please feel free to pause the video. Otherwise, moving on now. Resting ECGs are particularly suitable for evaluating the effects of cardiac glycosides as they provide a baseline recording of the heart's electrical activity while the patient is at rest. Cardiac glycosides, such as digoxin, are medications commonly used to treat heart conditions like heart failure and certain types of arrhythmias. Resting ECGs allow healthcare providers to observe any changes in the heart's electrical patterns that may occur as a result of cardiac glycoside therapy, such as alterations in heart rate or rhythm. Therefore, option A is the correct answer as it aligns with the specific purpose of evaluating the effects of cardiac glycosides. And correct answer, proper answer, option A, resting ECG. Let's go ahead and take a look at why the other answer choices are incorrect. Exercise ECGs primarily assess heart functional capacity during physical activity and are not specifically focused on evaluating the effects of cardiac glycosides. Ambulatory ECGs are used for continuous monitoring of the heart's electrical activity over an extended period and are not typically employed specifically for evaluating the effects of cardiac glycosides. Holter monitoring is a form of ambulatory ECG monitoring and is not specifically tailored for assessing the effects of cardiac glycosides. Stress test ECGs are similar to exercise ECGs and are primarily used to assess heart function during physical stress rather than specifically evaluating the effects of cardiac glycosides. That will do it all for the video today, guys. We'll be going into way more detail about ECGs going forward, so be prepared. These introductory videos are mainly just to give a strong foundation for students who are entering the phase of reading and interpreting these ECGs. I wish I had this when I was going in to learn about this, so that's why I'm making it extremely detailed. So I hope you guys appreciate this, and I hope you guys take a lot of value out of it. So with that being said, if you like this video, please feel free to leave a like and subscribe. And this is FixerMed signing off. Be sure to have a great day, everyone, and good luck studying. Goodbye.